I'm Dr. Robert Barnwell. I am the medical director here at Premier ER and Urgent Care in San Marcos. I am from Baltimore, Maryland. I became a doctor through the United States Army, and I served 14 years in the Army, and now I'm a civilian working here. It's very similar to an in-person visit. You typically use your phone or computer, and the doctor will use a phone or a computer, and then it's like a FaceTime call, and we can treat a lot of really minor issues, and you can do it from anywhere. You can do it from your house. I've had patients in their car. We treat all sorts of conditions, urinary tract infections, respiratory conditions, allergies. You think maybe you have to come in person to see, but we can actually do a lot over the video. It's a really convenient way for us to see patients and for patients to see docs. Absolutely. If a prescription is indicated, we can sort that out over the video. We type it in our phone. It gets electronically sent to the pharmacy of your choice. We can do multiple prescriptions if you needed. We can do prescription refills. You have a lot of patients who can't get in to see their primary care doctors because of COVID, or they need a negative COVID test in order to go see their doctor. And so this is a great option for folks who can't see their doctor, can't get in a timely fashion, and really need their medications. Yeah, there are some limitations. We can't do vital signs like blood pressure, heart rate, oxygen levels, that kind of thing. And then there's some complaints that really do need a physical exam to determine if there's something serious going on. And so what we do is screen you. We try to do everything we can not to have you go to the clinic, but there are some conditions that will require you to go. And if you're near one of our Premier sites, then we'll refer you over to our clinics, where it may just be an urgent care visit, or if you need a higher level of care, like an emergency room care, we can do that too. Yeah, COVID is all over the map. It's a respiratory viral infection similar to the flu. 95 or greater % of folks have really minor cold type symptoms. But once you start getting having medical issues like diabetes, high blood pressure, or immune deficiencies, those folks, or older age, those folks can get pretty significant lung disease requiring hospitalization. Generally speaking, most folks are doing pretty well unless they have some other underlying condition. It's an interesting virus. Everybody's becoming an immunologist and epidemiologist, and there's not any particular thing about COVID. It's just, like I said, a respiratory virus that sometimes causes severe disease in certain populations. Yeah, viruses cause inflammation. Inflammation can lead to other organ issues like inflammation of the heart, inflammation of the lungs, can cause clotting disorders. If you want to just screen your kids for summer camp, you can definitely get testing for that. If you're not having any symptoms at all, then you can do an antibody testing to see if you actually have had a prior infection. Most of the time, especially children, if they're young and healthy, and they don't have any symptoms, they'll do just fine. But I would worry about some of the more elite athletes, that they would need to get some more defined testing. You just because you have antibodies doesn't mean that you don't have the virus circulating around. You just won't get as sick if you do get COVID. And so the vaccine actually doesn't prevent you from acquiring the virus and spreading the virus. And so until we get enough individuals with immunization, with immunity, which is called herd immunity, where greater than 80% of the population has immunity, we're going to be wearing masks for a while. Thank you. Thank you. Yeah, of course. So moderation is the first thing. Really, the hangover is, think about it, it's really just dehydration. And so alcohol causes, is a diuretic. And so you will be urinating more and you will dehydrate yourself. And so if you can drink water, keep hydrated, and don't drink in excess. That's how you're gonna kind of lessen the hangover. But really, coffee, shower, all that kind of stuff doesn't matter. The way alcohol works is that it's time. It takes time for it to be metabolized. And I'd say generally no. The drug tests test for THC, CBD. Some of the lower quality or not purified forms of it may have some THC in it, so that could be positive. But for the most part, if it's pure CBD oil, it should not make a drug test positive. Some do. Some doctors are kind of arrogant, and they would get upset, but I don't care. Chiefs. They got a better record.
The Tampa Bay Buccaneers have a second Super Bowl title in franchise history.